How many times a week should you have sex? Why is sexual health important? Sexual activity is a basic human need, just like breathing, eating, or sleeping. When balanced, it brings joy, satisfaction, and better health. But if you do it too much, too often, without moderation, it can harm your health, your work performance, and your overall quality of life. So, how many times per week is healthy? And what should couples be aware of? Let's find out. What does sex mean for us? Sex is not just about reproduction. It plays a key role in mental and physical health. During sex, your body releases hormones that relax the nervous system, reduce stress, and bring positive feelings of happiness. Healthy sexual activity also boosts your energy, strengthens your immune system, improves muscle recovery, and keeps your skin youthful. But remember, sexual needs vary for each person. It depends on your age, mental health, physical fitness, your partner's health, your relationship, and your personal beliefs about sex. How does frequency affect couples? How often you have sex affects your emotional bond and personal well-being. Like eating or sleeping, sexual activity needs balance. If couples can't find harmony in this area, it can cause emotional stress and sometimes even lead to separation. So, what's considered a normal frequency? If after 2 days you feel physically normal, not tired, mentally happy, energetic at work, calm and emotionally balanced, sleeping well, then your sex life is probably in balance. But too much sex, done without moderation, can lead to physical exhaustion, mental fatigue, and even sexual or psychological disorders. To stay healthy and happy, couples should communicate openly, respect each other's limits, and build a healthy, consistent lifestyle together. How many times per week is healthy? For most healthy adults, the recommended frequency is 2 to 5 times per week. This level helps maintain emotional connection, supports heart health, mental wellness, and sexual function, without draining your energy or disrupting your daily life. Of course, this depends on your age, health, and personal needs. The most important thing is that both partners feel comfortable, never forced, and don't experience negative symptoms like pain, fatigue, or sexual dysfunction. If those problems arise, reduce the frequency and consult a sexual health specialist. Safe frequency by age group. Recommended frequency varies by age and gender. For men, ages 20 to 30, 3 to 5 times per week. Ages 30 to 50, about 1 to 3 times per week. Ages 50 to 60, about 1 time per week. For women, ages 20 to 30, 3 to 5 times per week. 30 to 50, about 1 to 3 times per week. Ages 50 to 60, about 1 time per week. These numbers are guidelines, not fixed rules. Listen to your body and your relationship. What are the risks of too much sex? Excessive sex can seriously affect your health. For men, constant effort during sex can cause fatigue, rapid heartbeat, and over time lead to problems like premature ejaculation or erectile dysfunction. For women, too much sex can cause vaginal dryness, pain, difficulty reaching orgasm, and an increased risk of tears or infections. Poor hygiene before and after sex also increases the risk of serious conditions like cervical or ovarian cancer. Unsafe sex raises the risk of sexually transmitted diseases like HPV, hepatitis B, gonorrhea, chlamydia, and HIV/AIDS. Emotionally, it can lead to anxiety, depression, and mental fatigue. What effects? How often you have sex? Several factors influence your sex life. Age. Younger people generally have stronger desires. Physical health. Conditions like diabetes, hypertension, prostate issues, or heart disease can lower libido. Mental health. Stress, anxiety, and depression reduce sexual desire. Cultural and social environment. Religion, education, and social values shape your attitudes about sex. How to build a healthy sex life. Pay attention to your partner's feelings. Practice safe sex. Learn about sexual health. Avoid alcohol, smoking, and other stimulants before sex. Never force yourself or your partner into a specific frequency. Sex is a connection, not a task. For many couples, 2 to 5 times a week feels just right, but only if both people feel happy and healthy. If you're facing challenges in this area, talk to a doctor. A healthy sex life is not about how many times. It's about balance, understanding, and care for each other.